With the end of the COVID-19 public health emergency comes the end of automatic Medicaid insurance renewals. In an effort to ensure continued Medicaid coverage for families, New York's largest not-for-profit insurance company is launching a campaign to assist the nearly 2 million New Yorkers impacted. Here to tell us more is Errol, Pierre, Senior Vice President of State Programs for Healthfirst. Very nice to see you again.
Yes.
You're telling me the last time you had a chance to talk with us on Here and Now was the Affordable Care Act.
Absolutely.
That was years ago. I had no gray hair then. You still don't.
Thank you. Thank you.
Thank you.
Happy to be here.
With
Happy
us
to be
this
here.
afternoon, because this is really some important information to get out. I think the first question I have is, why is the recertification process necessary, and why are we ending this automatic renewal?
Yes, great question. So when the pandemic hit, the federal government put in place something called the public health emergency. And that stopped a lot of things that used to happen, that were happening pre-pandemic. They stopped it for the sake of the pandemic. And so one of them was, well, why ask people to renew their insurance during a pandemic? We want them to go to the doctor. We want them to get a COVID test. We want them to get a COVID vaccine. So they just kept everyone insured. And that was happening for the last 3 years. So it went from 2020, 2021, 2022. And so people did not have to go back and make sure that they were eligible for their government insurance, mainly Medicaid. And so that's why they froze it. And now the public emergency is ending. And so we're reverting back to what we used to do before the pandemic started, which every month so you have to go back and make sure that you have your coverage renewed and make sure that you're eligible for the coverage you have.
It just seems like it worked so well when it was, especially if the person was eligible. If you're not eligible, it wouldn't automatically be renewed, correct?
Yes, but so things change, right? So what makes you eligible for Medicaid? It's your income, it's your family size, it's what county you live in, it's if you had changes in your family structure. So all of those things had changed, but we never checked.
Exactly.
And so now it's time to just make sure that people are still eligible.
Yeah, as you pointed out, since the health emergency has passed.
Exactly.
Now, what is the best way for people to keep track of their coverage status with Healthfirst?
Sure. So definitely call us. We have 24 locations all across the city, all over Long Island and upstate New York. Come walk in, we will help you. You can look at the back of your insurance card. We have a phone number, call that number. They'll tell you what your recertification date is. They'll tell you if you have to recertify, because not everyone does. But it's people who have Medicaid. I think the misnomer is people who have Medicare and also have Medicaid. We call them dually eligible. They have both. They have to renew their Medicaid insurance too.
Okay.
And some of them don't realize they have to do so.
And as you pointed out, I think you said this, but does everybody have the same renewal date?
They don't.
Okay.
It depends on when you enrolled, and usually your anniversary date is 1 year later. So if you enrolled in July, potentially your recert date is July of the next year, unless something changes. And so every month is a rolling group of people who have to do a recertification.
So, and if you have no idea when your renewal date is, you need to get on the phone or get online, and you can find that information?
Sure. Okay. So every state has a website. They call them the exchanges. In New York, we call it the New York State of Health. So you can log in to find out if you're eligible. You can find out if you have a recertification date. You can call the health plan you have, again, so whatever insurance card you have. If you call Healthfirst, we'll tell you your recertification date. And then there's some people that actually renew through paper. They get a paper application in the mail.
Okay.
And then they'll get that application in the mail. They have to fill it out and send it back in by the deadline.
Okay. The really important thing is you need to be aware that you are going to have to do this yourself this time.
Absolutely.
So let's talk about the renewal process. How do you renew? What's involved? Is there a best way, or is it the better way for you?
Sure, it's the better way for you. So we like this concept of no wrong door. We actually can do telephonic recertification. So someone can do it over the phone, in their slippers, at home, and get it all done. And we're going to ask you questions of, tell me your updated income, because income's going to drive whether you're eligible for Medicaid or another product. We have products that are available for people who make too much money for Medicaid as well. We'll ask you your family size, because depending on how big your family is, changes your eligibility for that as well. And if you moved, so say when the pandemic started, you were in New York, but now you live in New Jersey, you have to enroll through that plan as opposed to enrolling
in that state.
In that state.
Right.
And so all of these things we ask you about. If you're an immigrant, we ask for the right immigration status, documentation, whether it's your passport or visa or what have you. So this is information that we refresh just to make sure you maintain eligibility.
Now, considering we are out of this public health emergency, are we expecting that there are a lot of people that will no longer be eligible here?
Yeah, so the studies are, daunting. First, 62% of people who were surveyed didn't even know they had to do this recertification process. So that's the scary piece, that they don't know. And that's why we're trying to do awareness and make sure we get the word out. Two, last study I saw, there's 90 million people across the country that have Medicaid. There's a projection that 20% may fall off the rolls.
Because they're not eligible or because they don't recertify?
It's a mixture of both.
Okay.
Some people will lose eligibility because maybe they earn more money, so their income's a little bit higher, so they should get into a different plan, and we'll get that plan for them too. Other people, they just never knew they had a recert date, they didn't know how to do it, they didn't call in time, and they actually just got terminated. And if you've seen the headlines, many people are losing insurance that they're eligible for because they didn't act in time, and so they're just falling off.
So let's talk about those people that find themselves eligible for or ineligible for any of those reasons. What do they need to do?
Sure. Yeah, definitely. Like for Healthfirst, call us. We can telephonic renewal. We can enroll you in person. We can help you. One thing to think about is the website's in English and Spanish. So if those aren't the two languages that you speak, we can also help you, because it'll be confusing to know what to do if you speak, Haitian Creole or Urdu or another language. People who lose their eligibility, there's always another product to capture you. And so at Healthfirst, we have a range of products. Like, say, you might lose your eligibility because you're turning 65. We'll enroll you in Medicare. You might lose your eligibility because you're pregnant. Okay. We can put you in a different product. So there's so many different ways that can happen. Everyone's story is unique. The best thing to do is pick up the phone and let us help you.
So there are individual plans. I know some of them, the essential plan, the personal wellness plan. You help them choose, or they can choose what is best for their circumstance.
Correct, based on their eligibility. Absolutely.
And just talk to me. You talk about re-enrolling. But this is important.
It's huge.
And I think the pandemic itself pointed out why it's so important to be insured.
Absolutely. So we are already facing health disparities, which means certain populations have way more adverse reactions or adverse issues impacting them. Higher obesity levels, higher heart disease levels. So we already have these issues. Losing your coverage is the worst thing to do, because then when you're sick, that's when you find out you don't have insurance, when you walk into the doctor's office and they say you're not active. And so to shrink the disparities between these populations, we have to keep people covered. That's where it starts. The foundation is making sure people have insurance. And so we just want to make sure that people keep their insurance, because it gives you peace of mind.
Yeah.
It make sure that you feel safe and you have security. And God forbid something happens, when you use your card, you want it to work. And so you have to make sure it's active.
All right. And we are going to send folks to healthfirst.org. That is the website. And there's a phone number also, because I know that might be an easier way for many of you to contact the right people.
Absolutely.
It's 844-500-9820. 844-500-9820. Healthfirst.org. Errol, Pierre, thank you so much for explaining something that a lot of us don't truly understand.
Absolutely. We want to keep everyone insured in New York.
All right. Thank you very much.
Thank you.
We'll be right back.